Hi everyone, my name is Emily Foster and I'm a school counseling student at Mercer University. And today I will be discussing the topic of alcohol abuse in the elderly population. The reason that this topic is so important is because the population of older people in the United States is growing pretty quickly. According to the U.S. Census Bureau, in the year 2000, 35 million Americans, or 13% of the population, were ages 65 and older. By the year 2030, this number is expected to double to 70.1 million people, or 20% of the population in this country. And while many people do decrease their alcohol use as they get older, this is definitely not the case for a lot of people. Many people either start abusing alcohol in their older age or they continue to abuse alcohol if they've been abusing it for years. And alcohol abuse in the elderly population is a problem that is both overlooked and undertreated. So it's definitely important for counselors to be aware of this issue. I would like to start off by providing some basic information and statistics about alcohol abuse. Alcohol is a depressant to the central nervous system of the body. It is the most abused mood-altering substance in this country. In any given year, around 5% of the population in the United States meets diagnostic criteria for alcohol dependence. And in terms of older people and alcohol use, the National Institute on Alcohol Abuse and Alcoholism recommends that people over the age of 65 should have no more than 7 drinks in a week and no more than 3 drinks on any one day. But this is definitely not the case for many older people. It has been estimated that up to 16% of elderly people do abuse alcohol. There are 2 common drinking patterns for older adults, and these 2 patterns are called early onset and late onset. Early onset alcoholics make up 2/3 of the population of older adults who abuse alcohol, and this term is typically used to describe people who have a lifelong pattern of drinking. So in other words, they've probably been alcoholics for much of their lifetimes, but now they're growing older and being considered elderly. Their alcohol abuse most likely began during their 20s and 30s. And it's likely for early onset older alcohol abusers to have problems like antisocial behavior, poor relationships with family members, a decline in socioeconomic status, and a history of alcohol abuse in the family. Late onset alcoholics are a little bit different. They make up the other 1/3 of the population. And they differ from early onset alcoholics in that they typically begin to experience alcohol problems during their 40s and 50s. Late onset alcohol abusers are often more educated, they often have a higher socioeconomic status, and their alcohol abuse often is the result of some sort of stressful event that they've experienced during their lives. There are certain risk factors that can contribute to alcoholism in elderly people, and it's definitely important for counselors to be aware of these risk factors. So they include gender. Elderly males are actually more likely to abuse alcohol than elderly females are. Major life changes are also risk factors. A great example of a major life change is retirement. And retirement can definitely be a difficult transition for somebody who's been working hard and being very productive for a number of years. And once they are retired, they might experience feelings of boredom and that they're not as fulfilled as they used to be. So these negative feelings can lead to alcohol abuse. Older adults who have experienced a significant loss are also at a greater risk for alcohol abuse. Examples of significant losses are a decline in socioeconomic status, the death of a spouse or close friends, and a decline in health. Other risk factors include substance abuse earlier in life, comorbid psychiatric disorders, especially mood disorders, a family history of alcoholism, and a final risk factor is the abuse of other substances such as nicotine and prescription medications. And there are several signs that are associated with alcohol abuse in elderly people, and these signs include hiding drinking, drinking more with less visible effects, experiencing gaps in memory, becoming confused, being unwilling to discuss their drinking, making excuses to drink, hiding alcohol in order to protect their alcohol supply, becoming aggressive or abusive, neglecting appearance and personal hygiene, falling repeatedly, appearing depressed, neglecting their home, not paying their bills, and not taking care of their pets, frequent car accidents, poor diet, withdrawing from social activities that they used to enjoy, having disturbed sleep patterns, and talking about or attempting suicide. And it is important to remember that some of the symptoms associated with alcoholism in elderly people can often be mistaken for other symptoms associated with the natural process of aging. For example, falling down could be seen as a balance issue in an older adult. That's what a lot of people might automatically think, but it could in fact be because of alcohol use. While there are negative consequences for anyone who is abusing alcohol, there are certain consequences that are specific to elderly people who are abusing alcohol. For example, many elderly people who are abusing alcohol are also taking over-the-counter and prescription medications, and mixing these types of medications with alcohol can cause bad reactions and lead to harmful symptoms and health problems. Alcohol abuse can also lead to certain types of cancer in older adults. It can cause liver damage, immune system disorders, and brain damage. Alcohol abuse can also worsen certain health conditions that elderly people already have, such as osteoporosis, diabetes, high blood pressure, and ulcers. Alcohol abuse can also make certain medical problems hard for doctors to find and treat. One example would be that alcohol causes changes in the heart and the blood vessels, and these changes can actually dull the pain that might be a warning sign if somebody's having a heart attack. And finally, alcohol abuse can cause some older people to be forgetful and confused, and these symptoms could often be mistaken for signs of Alzheimer's disease. There are certain screening instruments that are especially helpful in determining whether an elderly adult has a problem with alcohol abuse. For example, the Michigan Alcoholism Screening Test actually has a geriatric version that consists of 24 questions that specifically relate to elderly people. So this instrument is definitely used pretty often. There's also a short version of this geriatric instrument that consists of 10 questions. And other screening instruments that are often used to determine alcohol abuse in older adults include the Alcohol Use Disorders Identification Test, or the AUDIT. It's a short 10-item survey. And then also the CAGE is another simple screening tool that consists of 4 questions. And those 4 questions are: have you ever felt you should cut down on your drinking? Have people annoyed you by criticizing your drinking? Have you ever felt bad or guilty about your drinking? Have you ever had a drink first thing in the morning to steady your nerves or get rid of the hangover? So all of these different tools can be used to help counselors determine if someone needs treatment. Effective treatment plans help older alcoholics deal with their alcohol abuse and hopefully learn how to live without using alcohol. There may be a variety of different aspects involved with an overall treatment plan, including detoxification, pharmacotherapy, individual counseling, group counseling, involvement in a 12-step program such as Alcoholics Anonymous, social therapy, and family therapy. And there are certain treatment programs that do specifically address the needs of elderly alcohol abusers. There are some special considerations that should be kept in mind when working with an elderly person who is abusing alcohol. Many elderly people may have a difficult time admitting that they do need help. Some people in older generations grew up believing that alcoholism was a moral issue that could be controlled if the person wanted to control it. So, in other words, many of them don't view addiction as being a disease of the brain. Because of their age, many elderly people also might not have as much of a will to recover as some younger addicts might. So it's definitely important for counselors to help them see the benefits of recovery. Elderly people also may not feel comfortable in certain treatment settings. For example, an alcoholic male in his 70s might not be super comfortable being in a group setting with a lot of other addicts who are in their 20s. So that's definitely important for counselors to keep in mind when making referrals as part of the overall treatment plan. And finally, a caring approach rather than a confrontational approach may work a lot better for many elderly alcohol abusers. Aftercare is the continued treatment and support for recovery, and there are certain factors that can help the elderly alcohol abuser have a successful recovery. And these factors include continuing meaningful social relationships through community programs and support groups. Participation in recovery activities with other alcoholics can be helpful. And education on proper nutrition and safe exercise for older people is also beneficial during recovery. Continuing support from family and friends and ongoing family and personal therapy can also help. In conclusion, I would just like to reiterate the fact that this is definitely a prevalent issue in this country, and it's definitely likely that a lot of us as counselors will work with elderly alcohol abusers at some point in our careers. So I hope you got some good information from this presentation. Thank you for listening.